So welcome to our webinar today, which is entitled Bridging the Care Continuum, High Acuity Support for Student Persistence. And this is a joint webinar between Mantra Health and Charlie Health, who you'll get to know a little bit more about today. The session, the way that we've had it formatted, is that it'll be about an hour. So we're planning to end by 3 p.m. Eastern time, and it's going to be comprised of a short presentation with at least 10 to 15 minutes of Q&A at the end. As you have questions throughout the presentation today, please place them in the Zoom Q&A function as they come to you, and we will start with those questions during the Q&A period at the end. The event recording and the presentation materials will be all sent after the webinar today. So again, every person will receive access to our slides and the webinar recording afterwards. And also at the very end, we will have a post-event survey as you exit. Please take that less than 1 minute survey because that really helps us plan out the topics of our next webinars. Okay, let's go ahead and get started. Let's start with some introductions. So I've already started. My name is Ethan Fields, and I'm representing Mantra Health today on the webinar. I work on the sales and partnerships team here at Mantra Health, and my background has been in student affairs. I used to work on several different campuses, mostly in residence life and student conduct, and realized through my work in those spaces, oftentimes being on call for an entire campus, that student mental health was becoming such a paramount need in terms of their successful outcomes, their development, and for institutional retention and success. And so I left individual campuses to then begin working for an organization called the JED Foundation, which is a national nonprofit focused on teen and young adult mental health and suicide prevention. For any campuses that are out there that partnered with JED as part of the JED campus program, I was one of the senior directors of that program and had the privilege to work with over 500 campuses nationwide that were looking to strengthen their policy, services, and programs related to mental health. I joined Mantra about a year ago to really focus on expanding digital mental health services as part of an institution's safety net and expanding the digital care continuum for students. So that's a little bit about me, but I want to introduce you all to our incredible partners at Charlie Health, beginning with Erin.
Awesome. Thank you, Ethan. Hi, everyone. So nice to meet you. My name is Erin Fogarty. I am the director on our partnerships team here at Charlie Health, who oversees all of our national digital outpatient providers. Obviously, Mantra is one of our close partners. That's why we're here today chatting. A little bit of background on me. It is not going to be as extensive as Ethan's because you're going to hear so much from me in just a little bit. But I do come to this presentation having previously had a role at Charlie Health on the clinical outreach team in the Northern California area. I am a clinician by trade and have been working with kiddos, young adults, and really teens in crisis for almost 20 years in my background. I'm also a mental health mom, so a lot of what you're going to hear from me today is going to take that preventative lens, just how we can show up and work together and collaborate for best quality care and connection for everyone. So that's it for me from now, but excited to chat more with you in just a little bit. I'm going to hand it over to Savannah. We're happy to have her here.
Thanks, Erin. Thank you all for being here as well. My name is Savannah Crippen. My pronouns are she, her, hers, and I'm a partnerships manager that has the privilege of working directly under Erin on her team at Charlie Health. My background is actually in public health, and I've always wanted to look at addressing behavioral health and substance use disorders as the public health issue that they are. I actually started my career in behavioral health in collegiate outreach, so the student population is very near and dear to my heart. I was once that student that struggled with anxiety and depression. And so I really want to make sure that we're creating accessible resources that are easy to navigate. And I'm so excited to jump into it with our care continuum. Passing it back to Ethan now.
Fantastic. Okay. And so as the setting for our webinar content today, we're really going to talk a little bit about the impact of mental health interventions and student retention, especially as we think about rising acuity levels among student needs. We're also going to explore Charlie Health's role within Mantra Health's stepped care model and how that can help support student outcomes. And then you're also going to learn a little bit more about Charlie Health's virtual intensive outpatient programs themselves, themselves and how they collaborate both with on-campus counseling and health centers, but also broadly within the student ecosystem. So to begin, just to introduce or reintroduce mantra to those that may been along for the journey or may be coming to us for the first time. We were founded back in 2018, and we exclusively focus on higher education mental health. We operate our own clinic of providers that really embed themselves within the fabric of each institution. We're currently working with over 125 campuses nationwide and serving over 1 million students across our partner campuses. And we have also really focused in not only on the clinical quality that we provide for campuses in our clinic, but also the way that our technology integrates into the systems for students, for faculty and staff on the campus side, and making sure that we have incredible HIPAA compliance, as well as other accessibility standards to increase that equity and access to services. And we are, again, working with a variety of different types of institutions, from two-year institutions all the way to large public institutions, because we take a customized approach to our work. And we know that a one-size-fits-all approach doesn't always achieve the outcomes that we're looking for, whether it's at an institution level or at the individual student level. As we talk about the care that each student needs, it needs to be a little bit more of an individualized approach. So I'm curious, from those in the space today, what are you seeing on your campus related to mental health acuity in particular? If you have any stats from your campus or any anecdotes from your campus that would be helpful, feel free to share in the chat. That will help frame our conversation today and help folks understand that there may be some similarities and experiences that folks have been seeing. I know, as I've been talking to a lot of campuses recently, they have been mentioning, that their BIT and care team reports are increasing, and the concerns that students are coming in with prior to even enrolling in college. It's a little bit different than what they're used to seeing. It's not only just the typical transition challenges, interpersonal relationships, family issues, anxiety or depression. Sometimes there needs to be a higher level of care. And what we know from data sources like from the NEA or the Healthy Mind study is that, over 60% of students have met a criteria for at least one mental health condition. And that has been a 50% increase in the past decade. We also know that it's not just about those that are diagnosed or that would screen positive for a particular mental health condition, but that students, 81%, 4 out of 5, are saying that their mental and emotional health is impacting their academic performance. So we know that there's a range of concerns that we're having, and that we're only able to serve a certain amount of students with our on-campus services, our community resources, and or the providers that the student already has a relationship with. And it's really interesting starting to see some of the things coming in the chat, from Glenna, that there were twice as many care reports than this time last year. That tracks with what I've been hearing from a lot of campuses, as we have trained more faculty and staff and students to refer someone they may think that may be struggling, or even themselves, to get that wraparound support. We are seeing more and more students being identified early on. And we're also seeing, from other folks in here, about the uptick in wellness checks. That'll be really important as we talk about the student ecosystem and how we're finding out about students, and how can we intervene earlier, or how do we get students that are at that higher level to life-saving treatment. And what I would say here at the bottom is that we know that as students are entering our care ecosystems, or whatever they may be experiencing, more students may require or are referred to hospitals for their mental health concerns. It can be challenging to find out what the true extent of that is, because it would take a variety of data sources. But the one that I have here is from the Association of University College Counseling Center Directors. So looking at the nationwide college counseling centers data, an average of around 14 students are referred either voluntarily or involuntarily to hospitals. on campuses. And that can range again between institutional type and and that doesn't reflect any other hospitalization efforts, whether that is, became necessary because of a campus intervention, or it was a person taking the steps they needed to get that treatment. So we know that there's more and more students that need that higher level of care, and that it goes even beyond just mental health. As Stephanie just mentioned, it's also about a person's essential needs. Another data point, again, as we think about the rising mental health needs of students, we also know that more and more students are seeking or are actively receiving therapy than before. But we know that there are certain levels of therapy that we can't provide reasonably on our campuses. So we often have to look beyond the campus for those higher intensive programs, whether it is an inpatient facility, hospitalization, or what you'll learn about is the innovative model that Charlie Health offers and how that expands the equitable access to those life-saving treatments. But what we know is that because of these the rise in mental health challenges, that we're also seeing the impact and being able to measure the impact that mental health is having on retention. So with our conversation today, start to think about all of the students that may have risen to needing a leave of absence, or has been shown up in a BIT or care team referral, or those that are coming to academic advisors or other folks on campus that are considering stopping out of their academic programs, and what other resources could be available to surround them with the higher levels of support that they need to maintain their enrollment and to continue on, even if they take time away, to be reintegrated into the campus community and not lose access to services because of that process. So as we think about a care continuum, how do we create these interventions at all aspects of a student's journey to be able to surround them with that level of support? Mantra has developed our whole campus care model based on the JED comprehensive approach to mental health and suicide prevention, which is also used by the National Suicide Prevention Resource Center, as well as the stepped care 2.0 model that many campus counseling and health centers also employ to provide individualized student treatment recommendations, depending on what level of concern they're coming in with and what needs match really to what is available on campus, or as we like to say at Mantra, within the digital space as well, to complement, extend, and expand upon what's available on campus and within the community. So as you look at this screen, we have plugged in a variety of different solutions and resources across that care continuum from left to right, based on a few different stages of a public health approach. So on the far left, we start in the health promotion area, some of the upstream prevention activities that we know can be essential in helping students develop critical life skills and resilience, as well as fostering social connectedness and belonging. So at Mantra, we've developed online modules, which we call self-care, rooted in dialectical behavioral therapy. And we've even increased that recently into a productivity content area focused for students with executive functioning concerns. We also partner with Togetherall, which is a global leader in providing an anonymous, clinically moderated peer support community. This is really helpful in students finding community both in person and digitally in, again, a clinically moderated space. We know a lot of students turn to Reddit and other online sources, but we're not able to in those settings, they're not always getting the best information and they're not always getting the right level of intervention. So we use Togetherall as part of our integrated model to expand that access to digital peer support, as many campus counseling centers, Residence Life, everybody else is recommending students to connect with their peers, make friends, etc. Moving up into the center part of our model, we also know that we need to increase students' help-seeking behaviors and increase pathways to help. And so a lot of us are doing a lot of work on campus to increase that subclinical support and increasing ways for them to either come into counseling centers earlier with on-demand appointments. Let's Talk programs are super successful, embedded counseling models in academic programs or in different spaces on campus, just to expand that access and knowledge of resources. For us, our Connect Now program, it hits at two different parts of our model. Connect Now for us is our on-demand emotional support sessions via video or phone, available 24/7, 365. And they're meant to be an urgent care model for students' concerns. Around 80% of students that have used Connect Now have done it based on a personal issue, a life issue, interpersonal issue, whatever it may be. And then about 20% others are actually using it because they're having escalation of symptoms, or they may be in crisis. And so by embedding ourselves within the campus ecosystem, we're able to refer students to the right resources on campus. We're able to follow the relevant campus protocols if it increases to the level of needing a hospitalization or in-person mobile crisis intervention, while maintaining that transparency and visibility into the reporting back to the campus stakeholders within an hour of the session. Connect Now is unlimited. It's a great opportunity for students to use it, regardless if they're in therapy or not, or maybe it's even in between sessions when they need to talk to someone. And being able to offer that after hours and on weekends can be a really helpful access point. We also have an emotional wellness coaching program and an executive functioning productivity coaching program that pairs with our content back in the promotion area of this model. These are 8 to 12-week experiences for students where they meet one-on-one with a coach virtually. They're able to chat in between sessions with the coach within the Care Hub platform that we have. And the coach is able to assign modules, track the student progress on their goals towards meeting those and completing those modules, and reviewing their reflections and goal setting as part of the experience. This is a really helpful way of expanding that subclinical capacity, as we know more and more students are being referred to the counseling center, but actually could benefit from a coaching relationship rather than a full therapeutic dosage or intervention. At the farther end of our spectrum, we do have our own clinical care ability. We have therapy, psychiatry, both at the NP level and MD level, to support and expand what's available on campus. But what I'm really excited about is that we're even able to take that a step further with our partnership with Charlie Health. As we know that even with scheduled therapy and/or psychiatry, there are needs for students that go beyond that. We know that they also can go beyond what is available in your local community. You know, for many rural campuses, it may be 4 hours away for the next specialty care option, hospitalization, whatever it may be. And even if that is physically accessible, that doesn't mean that there's not a long wait time, or it may not be the most appropriate treatment for what the student needs. And so I'm really excited as we go through the rest of the presentation to talk about Charlie Health's model and how it integrates in as we at Montra try to work with any type of student on a campus that is coming to us and making sure that we're able to get them to the right level of care. And even with what we're able to do at Mantra, we know and what's available on your campus in your campus counseling or health center, if you have one, we know that a student's experience goes way beyond that. All of us kind of play into the student ecosystem and have an opportunity to support them at each level. And so what will be really interesting to learn about with Charlie Health is that referrals don't always have to come from counseling and health to this treatment. It's something that a student can learn on their own. It's something that a friend can refer them to. It's something that other folks on campus can be educated about and able to refer them into if it's getting to that level of acuity, or it could be a good match for what their needs are. And this just, again, opens up access points so that it's not all on the select few of us that have dedicated our work in mental health and well-being on a campus to be able to, again, refer a student to the appropriate level of care. So I'm going to turn it over now to Erin, and you can take it off from here.
Thanks so much. I just want to pause for a second and even go back to that student ecosystem slide, Ethan. This is one of my absolute favorites. I think coming from the clinical outreach team, but then also working here on partnerships, having been a student myself, and Savannah's going to share her experience too, we know that students engage actively in various different groups on campus and really escalate connection based on what's going on in the community, what's going on in their neighborhood, what's going on in the political climate, whatever it may be. So there's a variety of different ways that students can come to seek support from others, peers or professionals, and that they can come to know about what services are available in their community. And so absolutely our partnership with Mantra is incredibly valuable for us. In addition, we do have our really robust clinical outreach team who's out and about in the communities, literally boots on the ground to get to know where else are students engaging and how else can we show up and support? Where can we put a table on campus? Can we hang some signs in the student resource offices or near the cafeterias and things like that? Because students can and will self-refer to our program as will the people who care for them. So just wanted to call that out, but we're going to jump right in. The next few slides are going to be just who are we, what do we do, and how can we work collaboratively to support you and your student body. Our goal here at Charlie Health is super ambitious. We continue to strive for this every single day and lots of work to do, but ultimately our goal is to connect the world to life-saving mental health treatment and to create a world without suicide. So let's talk about how we do that. This slide here is going to talk about, our positioning in the continuum of care for behavioral health. Very typically, an IOP or intensive outpatient program works with high acuity clients who are stepping down to the service. So when we think high acuity, those are our clients or students who have had a recent psychiatric hospitalization. Maybe they visited the emergency department, were screened and released. Potentially they were on a 5150 and stayed there for a couple of days, oftentimes in a hospital bed, having been an emergency clinician myself, or they've had a little bit of a longer stay in an inpatient unit at that hospital or out of the county. Also high acuity would be anyone who's engaged in a residential treatment program for any length of time. Coming into a program like Charlie Health would be a step down service, and sometimes even you will hear the acronym, the PHP, or a partial hospitalization program, even in between the two. Where I think there's a real sweet spot, and this is like my mom brain that always comes in, is those who are stepping up from connected services are actually waiting. I saw in the chat that there's, of course, a limited availability for services in some of your communities. Students may prefer to have inpatient or in-person care, but be unable to access it. We know there's transportation barriers, things like that. And so when on the right-hand side here, it's showing outpatient centers, let's think of that student ecosystem in place of that for the purpose of this discussion. So individuals or students who are engaged with campus counseling centers, but are only seeing a professional once a week, once every couple of weeks, and it's been identified that they need a bit more than that. Also students who are not coming to the counseling center, but have maybe reported to their resident advisor or to an athletic department coach or support system that they are struggling and that they're needing more support. These are also students who are new to the college dynamic and to the expectations. They're away from home for the first time, struggling with that difficult transition. This is a current episode. We love to take the terminology around episodic care model, where we identify that there's an episode or an identification of multiple things going on and showcasing that this person is needing a little bit more support. And so Charlie Health is a step up service for those type of students. And if whenever safe to do so, acting as a hospital divergent. We're not always going to be able to do that, but in many, many cases, if we provide really strong wraparound care, lots of love, lots of support, we can help people build the skills that they need to get back up and on their way and to stay engaged with the things that keep them well. So we're going to talk more about what that looks like, but keeping in mind going into the next slides that we are a 100% virtual program. We're currently in 40 states, and our age range to have in the back of your mind is 11 to 49. So it's an updated age range if you've had visibility to Charlie Health before. Really excited to share that updated age grouping as of Monday this week. So let's go into the next slide here, which is probably our biggest takeaway on the Charlie Health side. If this is all we had, we would be happy with this slide here. But It's a snapshot here of our 360-degree treatment ecosystem. As an IOP, there's a few things that we have that are going to be exactly the same at a certain level to what you have in your local communities in a brick and mortar. And then there's going to be things that are optional or additional as clinically relevant or as preferred by the client or family who engages with us. The piece that they must do for an IOP is a facilitated group. And so just like any others in your community, Charlie Health is going to be 3 group sessions a week. Each of them are 3 hours, giving us a total of 9 hours of facilitated groups. We're going to talk in a little bit about how we actually place people into groups, how we match them, how we really leverage lived experience and create a personalized experience. But the 3 group sessions are broken down into an evidence-based therapy for 1 hour, more integrative, experiential yoga, mindfulness, meditation, 2nd hour, and then a processing group to make up that 3rd hour. All of those together are 1 session, and then we do that session 3 times a week for that checkbox of 9 hours. The next piece is individual therapy. So every client at Charlie Health is in our facilitated groups, and we'll also have 1 to 2 hours of individual therapy every week based on clinical need. There is not a world at this time where a student could just come to us for one of these or the other. If we do get a referral from Mantra for a student on one of your campuses who we talk to about the program and they don't really think it's a good fit or they can't commit for whatever reason and they're just looking for one-to-one, we have fantastic established partnerships, so we'll make sure to get them connected to whatever is the best fit for them. The goal is not to squeeze everyone into Charlie Health, but just to make sure that people have a plan that works for them and that they know and they understand and that we have personally vetted to be truly accessible for them. So facilitate groups, individual therapy, and then everything from here is kind of optional. So we do offer family or chosen family therapy as well. We highly, highly encourage this. It is absolutely a critical X factor in terms of long-term outcome for our clients. When we think of our students, this is where chosen family comes in more often than not. This is their intimate partner. It is their roommate. It has been a residential advisor. It's somebody on campus who's really, really committed and cares for them and wants to show up for them in this capacity. So it's really beautiful to have. Not every student will agree to this. A lot of people will not agree to this initially. And then we will work with them through our care coaches and family support groups that you see underneath to engage them through the window in a different way until they're willing to kind of bite on to this piece of the puzzle. But I love Charlie Health's Chosen Family Program and Therapy. Incredible. Couldn't say enough about it. So big call out there. We offer psychiatry and medication management as well. This is based on clinical need. So it could be something that was identified as a need when the student was referred over to us by the campus counseling department. It might also be something that comes up during our initial biopsychosocial assessment. We're going to spend a good 90 minutes or more with the student, regardless of whatever information comes. We're still going to hear it from them and get a good understanding of what's going on for them from their own experience. This may come up there. It also may come up in care. So not everybody will need psychiatry and medication management, but it is available. And we try to be as immediately available with this as we are with the rest of our program. Typically, it takes about a week or so. But if there is a more urgent request or medication need, then we will do our very best to provide sooner support if possible. A call out here is if one of your students is already engaged with a campus provider or in their own community with a psychiatrist, we do not require anybody at any time to close off services with their current providers. Some providers will wish to close those off, in which case we'll absorb that responsibility and of course that commitment to the student. But if they are connected already and it is going well, it is so hard to find available high quality providers as it is. We would love to just work collaboratively with the campus team or with the community partner and share information back and forth as needed and relevant to best support the student. So we do not want them to close that off if it's not required in any way. What you see at the bottom of this slide is more around our wraparound services that are optional but available. And like I said, as a clinician, this is one of the reasons that I came over to Charlie Health was like this truly outstanding wraparound care I always use the soft verbiage of lots of love. I think it's who I am, and I think it's what we do best. But we know that crises come up outside of regular appointments. We know that they come up when the offices are closed. We know that students are having to engage with maybe campus security or campus police departments. And sometimes there's better relationships on some campuses than there is on others in that regard. And so having Charlie Health available with a 24/7 crisis line to be able to respond to students after hours and even during session if something comes up significantly is a really fantastic resource to reduce the burden on the campus system, but also to, whenever safe to do so, as I mentioned, act as a hospital divergent. And we know there's tons of statistics out there from 988 lines and everyone else that a lot of crises can be supported over the phone. We can reduce the burden on emergency departments and actually the financial burden that comes from a visit to the emergency department or with an ambulance ride as well. So not an option in all scenarios, but in many, 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 it absolutely is. We have dedicated care coaches for every client at Charlie Health as well. There's actually about a team of 7 to 8 clinicians who will work with every student when they're engaged with us. One of those individuals on our support team is going to be the care coaches who are here as encouragement, as mentors. They often have really relevant shared life experience, and that's how they were aligned to that particular group. We rely on them a lot, and we love them a lot, and they really help us get over some of the humps that I think were identified in the chat around, I don't want to do telehealth. I would really like to do in person, but in person is actually really far away, not actually available. And there's probably not a whole lot of people sitting in that in-person group who relate to what I'm going through, but our care coaches do. They will help with that. They will help around that ambivalence too, just around groups in general. There's probably nothing worse that you could say to a student at any age other than group work, right? And so there are ways to navigate those conversations, which Savannah and I will do, as will the rest of our team, but our care coaches are really instrumental in that. Our family support group is really, really cool. Again, think chosen family here, that this is sometimes the window by which we get people to engage in family therapy. We offer a really robust menu of free and accessible daily activities, including evenings and weekends for families to engage in. There's psychoeducational groups, there's processing groups, there's also self-care Saturdays. So this is a nice big menu. Families can pick and choose what they want to go to if they want to do anything at all. But we see really, really high attendance at these support programs, and they will remain available indefinitely to a client's loved one even after they've completed treatment with Charlie Health. So I think that's the biggest call out here. I did forget to mention that the average length of stay with us is around 10 weeks for those high acuity clients who are stepping down. And then when we take our preventative friends, students who are needing just a little bit more, wanting to get back up and on their way, often I encourage our campus partners to think around like a 6 to 8 week model for those students from a preventative lens. We can hop on over to the next. This here is a quick snapshot of the type of students and clients that we work with, very high acuity. We're going to give a little snapshot later around like who is a good fit for Charlie Health and who isn't. But this might reflect some of the student bodies that you are each working with. As Ethan mentioned early on, we're seeing a dramatic increase in self-reporting of depression and anxiety. A number of different sources are going to show a number of different data points, but they're all going to be extraordinarily high with a lack of resources available to our young people. And so Charlie Health works with a number of clients. More than 35% of clients who come to our program have had a serious self-harm incident in the last 30 days prior to coming to Charlie Health, and nearly half of them have had a suicide attempt in their lifetime as well. 73 and 64% respectively do identify themselves to have moderate to severe depression and moderate to severe anxiety at intake as well. We can go to the next one. So I'm going to introduce our friends here, and Savannah's going to take it away. But these are two kind of student examples that we have, and we're going to showcase how they go through our program and what it could look like. It will be very, very different for both of them, and that is exactly what Charlie Health is about. Naya is 20 years old. She's in college. She's away from home for the first time. She has a lot of responsibilities that are really, really new to her, and she has a history of sexual assault. She has been working with her school counselor, but she's only able to see her counselor for half an hour every week and just doesn't feel like that's enough. And with all of her competing priorities and pressures, Naya doesn't feel like she's going to be able to graduate. And so anxiety is increasing here. And with that, she's withdrawing from her social community. On the other side, we have Sammy. Sammy is 32. He's a dad. He's in graduate school. He's a great student, but he has two little kiddos at home. I think our actual background on Sammy is that he was in the military as well and had a discharge from the military. Also, lots of competing priorities, a very unique schedule. He is smoking weed to cope. He doesn't really have any coping mechanisms at the moment, and recently checked himself in to an emergency department, feeling complete overwhelm and just did not know what to do, fear for hurting himself or hurting others. And so these two individuals, which Savannah's going to chat about, these are not unlike any of the clients that all of us work with every single day. They are totally different. Yes, they are both adults. That's about it that they all have in common. The therapy style that's going to work for these two students is going to be very, very different. The peer group that they need to relate to is going to be very, very different as well. So when we send them into a brick and mortar, an 18-year-old is an 18-year-old, which means they're suddenly an adult. And they're often going to be working with 30, 40, 50-year-olds who don't really have a ton in common. So I'm going to hand it over to Savannah and she'll walk us through that next little bit.
Thank you so much. So speaking about how there may be 18-year-olds in groups with others adults, remembering that I did work in collegiate outreach at the beginning of my career, I want to share a story about a young woman very similar to Naya who actually dropped out of a different IOP that had helped connect her to in a different organization. And the reason she cited was that she didn't feel like she could connect with anyone in her group. She was with other adults that were over 40 years of age that had trouble with substance use disorders, while she herself was struggling with anxiety, depression, and similar to Naya, she had had a sexual assault. She didn't want to be in another room with older men. She would have appreciated perhaps if she could be with some women that had experienced what she had gone through. And while we recognize that in-person care is not something that we are trying to be a replacement for, we understand that there are going to be scenarios where we can create a better fit for that patient in our care versus if they were to go to a brick and mortar clinic. Here's some of the traditional barriers that other students have cited as well. Wait list. Knowing that you have to wait multiple weeks before you can speak with someone, that's going to be a huge deterrent to actually following through with care. They are trusting us when they finally are willing to come into treatment. And so one of those X factors may be getting them into care safely and quickly. Also, they have to go outside of their safe space. When we're in college and we're away from home, we're already in a brand new environment. Now, on top of that, imagine going to an inpatient clinic that sometimes may feel very prison-like, some of the college students have told me, right? We want to create a warm and welcoming environment where maybe they're logging in from their dorm. Maybe there's a separate room in the library that's closed off and confidential where they feel like they can have that conversation and feel safer. We want to make sure that we're reducing the loneliness that they may experience. You see here, this is an example of maybe traditional care where Sammy and Naya would be in the same group with others of various age ranges. The spread here is everything from 20, how old Naya is, to 32, how old Sammy is. It's not gender specific, it's not condition specific. And so it may actually increase the loneliness that they're feeling because they think they're the only one experiencing their reality. It also may be very inflexible. There were several students that I worked with that actually were considering dropping out of their course load because they didn't feel like they could maintain treatment at the same time as furthering their education. We know that that isn't always protective of them, right? They don't want to feel like a failure, like they had to pull out of something that they really cared about. We want to really offer the opportunity for them to stay engaged in the things that are most important to them. Like I mentioned before, curriculum may not be specialized. And so they're getting a one-size-fits-all approach rather than hearing about modalities that can support their specific needs. And if there's any therapists in our community here today at your schools, you know that you sometimes have to be a jack of all trades because you don't know who's going to show up into group that day, whether it be because of a geographic region, their insurance had to match up. And then there's tons of different modalities that would support them, but you have to be able to do everything. At Charlie Health, we do that a little differently. We're going to match them with therapists that can meet their specific needs. And I'll tell you more on the next slide. Thank you. So what we do is multivariate treatment mapping. So our clients aren't going to be in the traditional system that you saw on the previous slide. They are going to be matched based on these variables. They will be with others that have a similar condition to them, that are also in a similar age range. It can also be gender specific if that's something that's important to them. We're going to make sure that they are matched with specific modalities that are going to treat their needs. And this is what I think is most important to me, at least, having been that college student, is our lived experience is something that Charlie Health is going to consider when matching us with others. Knowing that Naya has had specific experience with sexual assault, we don't want to place her in a room where she may feel like no one understands what she's going through. Our own founder, Carter Barnhart, had actually experienced sexual assault, and she said something that was really crucial to her healing was being in a room with other girls that said, "Me too. I understand how you feel." And so one more time, just to go through this, they are going to be specifically put into personalized group based on their condition, their age, the modality that is most appropriate for them, and their lived experience. Moving on to the next slide. So this is what that looks like from referral all the way over to first session. Like I mentioned before, immediacy is something that we care a lot about. It's actually in our values to act with urgency and make sure that we are committed to connecting them to others as quickly as possible. Naya was referred by one of her therapists at her college, and her assessment was scheduled for the very next day, so she didn't have to miss class. Sammy was referred by that ER that he had checked himself into, and there was a discharge planner that made sure that he could get connected to us and actually start group that night. This is going to be affordable. We are in network with many of the student insurance plans, and so Sammy's able to do our program with simply his copay and out-of-pocket deductible. Naya has a unique situation, but not entirely unique. She wants to use her parents' insurance, but she wants to make sure that she can actually have the confidentiality because she isn't prepared to share with her family that she actually experienced that sexual assault. She still feels a little bit of, stigma and a little bit ashamed about that, but she can use her parents' insurance with a minimal out of pocket and trust that we are going to keep her information confidential. Going on to intake, again, this is talking about how we really personalize those groups. Naya is going to be with other 18 to 24-year-old females in a trauma-focused CBT group, while Sammy is going to be with others that are in the 30-plus age range. And we're going to make sure that his scheduling is in the evening so he could attend his courses and also attend treatment and make sure that he's watching out for his kiddos. It's after 7 p.m. and so they're going to be in bed and he can actually focus on himself since he pours so much into others the rest of his day. Similar with flexibility for Naya, she's able to work around her course loads and make sure that she can attend her groups in the evening as well. With the first session, they're both logging on from safe spaces, and you'll see that Sammy joins from sitting in his backyard with his emotional support dog, and Naya is logging directly from her dorm room when it's empty with her other roommates. So this is all built around them and for them, really trying to increase access to care and make the patient experience very easy. That way your students can stay engaged in the things they care about most. Next slide, please. I'll pass it off to Erin to share who's the best fit for Charlie Health. What does that student look like?
Thanks a bunch, Savannah. This is going to be a little bit of a recap of some of the things that we've chatted about already. But first and foremost, reminder that that age range for Charlie Health is currently 11 to 49. This will encapsulate a good chunk of our college age students and faculty. We definitely work with more than just students. So anyone else on campus or just anyone else in each of your social networks that you feel could benefit from support via Charlie Health, please consider the program and our availability. We do, as Savannah mentioned, work with most commercial insurance plans. We currently have about 400 insurance plans in our network, all of the major insurances, absolutely. We do work with Medicaid as well in states that cover IOP. If you have any questions around coverage for your specific state or a specific insurance plan, Savannah and I will pop our contact information into the chat, and you can absolutely reach out to us via call, text, or email at any point. I will say with this, we do often have students or families that are unable to engage, but maybe more preferentially would like to engage in one-to-one therapy or like are not quite sure and are contemplative, but it is challenging to find covered by your insurance providers. And so sometimes we will have individuals who will come to Charlie Health and give it a whirl and actually end up sticking with us because they have a really nice experience because of the coverage and accessibility that Charlie Health offers. So if you have any questions on that, please reach out to us. We work with a wide range of mood and anxiety disorders. This is not an exhaustive list here, what you see in the center bubble, but it is a really nice snapshot of the population that we work with. Again, we're thinking those who need more than regular outpatient therapy or waitlist, and then those who do not need a closed or supervised setting like an inpatient or a residential. Two big call outs, I would say. Actually, maybe let's take a moment and we'll talk about three of them. We are primary mental health, and we do have a primary substance use license in a number of states, but we do not provide medical assisted treatment at this time. So if a student is referred over, which we have seen an increased need for substance use disorders related to opiates and specifically fentanyl, a virtual IOP for co-occurring is not going to be the most appropriate and safest option for someone right now in this moment if they're actively using fentanyl and other opioids. What we are going to do is leverage the relationship that we have with Mantra to support that student, and then with our additional partners that we've identified in the community to help get them connected to the best and safest option for them. So absolutely work with substance use, absolutely work with co-occurring disorders. This is going to be a wide range case by case of how we will assess safest option for your student. The next one is going to be eating disorders. So we do not work with primary eating disorder diagnoses at Charlie Health at this time. We will again work with our identified community partner to get students diagnosed with eating disorders connected to the best resource for them. It may be virtual, it may be in person, it's going to be case by case. We absolutely do work with students who have disordered eating habits and behaviors. It's just dependent on primary diagnosis in that regard. And then the third one is going to be psychosis. So psychosis is a case-by-case assessment as well. We absolutely can and do and will work with students experiencing psychotic features or behaviors. That being said, it is a wide range. Anyone who's a clinician on this call knows that it's a very wide range. If someone is taking their medications as prescribed, they are able to engage over the virtual space, then something like Charlie Health could be a really, really great fit for them. And we see this come into a lot of communities that have extraordinarily long wait lists. Up here in the Bay Area, we have some programs that have closed wait lists because it maxed out at the 2 years. And so you can't even get on a wait list for services in a couple of years from now. So it's a really great resource as an available option if someone is able to safely engage in the telehealth space. I would say that's a great summary of this. We do have additional resources, which we're going to pop in the chat there too, which will showcase what we do and don't work with. Pretty much, if it's not one of the three things I just mentioned, we'd absolutely do work with them. And we're able to do that because of the sheer number of clinicians that we have at Charlie Health, which is currently about 750 clinicians. And then the number of groups that we offer every single day, 6 days a week. We're morning, afternoon, evenings, and on weekends. So there's lots of different slots where we're able to take all of this and then find you your bundle across the country and then find you the schedule that works for you. And for context, we just served our 55,000th client through Charlie Health. So yeah, we're definitely able to make that niche connection. So let's hop over to the next. Great. We are not going to showcase a ton of data, but we're going to share this one. I know we want to wrap up on time. So just really quickly, this is our favorite data point that we have. We're working with those really high acuity students and other clients who come into care with recent hospitalization, high suicidality. After completing treatment with Charlie Health, only 2.3% of these students are needing to readmit to a higher level of care post-discharge. So they're not attending to emergency departments at all. This is based on claims data. And they're able to re-engage or have stayed engaged the entire duration of care with their campus. We can go to the next. These are just some testimonials, but I know that Ethan has some really great resources and things he wants to talk about. So maybe we can share these later, Ethan, if you'd like.
Absolutely. Yes. We'll be sharing out again all the slides with these amazing testimonials about students that have used Charlie Health and how much it has impacted them, not only in terms of their mental health and well-being, but also, as you can see here, how it relates to their coursework and staying enrolled in school. And then in general, this final one, which I just find so impactful as a suicide prevention person, that they feel that they were alive because of the care they received from you all. So thank you both for everything that you've shared today. The last thing I wanted to share before we move to the Q&A portion is just, again, the opportunity about integrating Charlie Health into a Mantra Health partnership. And so I mentioned earlier that we leverage a lot of two different technologies, both student-facing but also clinical-facing. And so what we call our clinical collaboration portal, we have the opportunity for campus counseling and health professionals to directly refer students into the Charlie Health treatment. And also, based on a shared release of information, be able to track the progress of that student through their program. Again, oftentimes whenever we're referring a student out for that specialized care, that higher acuity care, we may not have a memorandum of understanding with a local hospital or inpatient facility to be able to know, did that student get the treatment that we sent them to? Were they discharged, etc.? And so within our collaboration portal, you're able to make the referral, you're able to track the student's progress through their experience. Our clinicians also are able to refer students into the service. And again, because of the accessibility of Charlie Health Services, they're able to participate in their programming and treatment with Charlie Health from a variety of different locations, depending on whether they're on campus, online, etc. Okay. So want to turn it over to Q&A. I know we have a bunch that have come in through the chat. First, the first one that I wanted to ask to Aaron and Savannah, this is a school where students aren't required to have health insurance, and many have high deductible plans. Are there any additional supports that Charlie Health is able to provide, or are there examples of how schools have even been able to support those students in accessing this treatment?
Yeah, absolutely. Thanks, Ethan. Definitely, we're going to see that a ton day in and day out as we stroll into the start of 2025. And so we do offer financial hardship assistance. We do require the student or the financially responsible party, which may be a parent, depending on who the insurance is through. They will need to fill that out, and we can offer support. Typically, it does help with out-of-pocket or copays. It is different for every client, could be a couple $1,000, could be a couple hundred. Everyone's needs are so different, but absolutely, we will try our very, very best to work to reduce any financial barriers. Likewise, we will do the same with technologies. Most people do have the technology that they need in this age, but not everybody does. And so we can support with tablets and other things too. But yeah, we definitely will try our very best for finances to not be a barrier to care.
Perfect. Thank you. And then we have a question a little bit about the differentiators between what Mantra's Connect Now crisis line is and then the 24/7 crisis line that you all provide for students. Are you able to speak a little bit more about how that works for students that are in treatment with you all? And I can follow up with more about the Connect Now piece.
Sure. Yeah, I will speak exclusively for ours. So our 24/7 crisis line is for clients and families who are connected to services. So from moment of intake forward, it's an available service for them. It is not a line that is open to the general community or to the public. We do have active safety plans on all of our clients, and we know who is within their treatment bubble. So it is a service for those who are connected to us exclusively.
Yes, and then for Connect Now, that is more of a population-wide on-demand phone and or video session, and understanding, if a student is bringing up that they are in active Charlie Health care, then we can also point them toward Charlie Health's resources if they need additional follow-up related to that specific care type. But our Connect Now can help with more broad challenges, single sessions, and be able to follow the campus protocols as necessary for reporting back, but also in terms of any types of campus-based interventions that may need to happen, like a wellness check. Yes. Looking at a few other questions here. The next one is, you had mentioned a little bit earlier, Aaron, about how you all have tabled at different events on campuses. So do you have any other examples of how you've trained other personnel or students on campus beyond the counseling and health centers to refer students to Charlie Health?
Yeah, I'll give a quick snapshot, maybe then hand it over to Savannah, but definitely we do all different types of like tabling events, student presentations. I recently did one over here in the NorCal area at one of the campuses where it was like a student-led mental health team who was bringing in various community partners to talk about like it's not a Charlie Health pitch. We don't go into the schools to give a pitch on Charlie Health. We'll go in to support in whatever capacity and whatever subject matter they would like representation on. And then we will just also have our resources there. So I think that's probably one of them. I personally have had a long-standing, this is embarrassing, but like a long-standing position on a podcast and radio show at one of the college campuses up here to just talk about mental health. The holidays are coming. This is anxiety provoking. What are we going to do? Again, it's not a Charlie Health pitch. Has rarely do we even say anything about Charlie Health. We just show up as a resource for mental health support on campuses. So I'll let Savannah answer as well, but you name it, we've done it and we'll do it. So
Yes, thank you so much. So similar to Erin, I was also on the outreach team over here in California prior to coming into partnerships. And so there was one time I came onto a campus and they wanted to have different stations to kind of give an example of what it looks like to get mental health support through various modalities. So we had one where we were doing song lyrics and poetry. We had another station where it was art and wellness and meditation and things of that nature. So similar to Erin's point, we really want to hear from you what you need. And then we look to try and fill those needs with our services, whether that be bringing an outreach team member onto your campus to make sure that students are aware that they have access to the resource, or whether that's meeting on a webinar similar to this to speak with your counselors to make sure that they're informed of the referral process and know who to reach out to when they need support. The short answer is just let us know what you need. The long answer could go on forever because we're going to make it happen.
I love
yeah,
that.
I'll just jump in and say one more thing, Ethan, if that's okay. Definitely we work with the counseling centers. That's an obvious, but I would say our identity service groups, like our queer support, is really fantastic at Charlie Health. And so we do engage with on-campus queer and BIPOC centers very, very, very frequently. I also have had a lot of exposure with international student success offices as well as disability offices. And then like through and through, I believe that there's such a valuable opportunity connecting with our campus police departments and maybe softening some things along the way with them. So that's usually much appreciated.
Absolutely. And I think that from the mantra side as well, we want to activate the entire campus in boosting utilization of the Care Hub, of all the different types of services, and engaging with all the different types of decision makers and groups on campus so that they understand what all is available to them, both on campus and through these digital mental health partnerships. And I think we have time for one more question. Of course, you all can use our emails to follow up with any questions after the webinar. But the last one was, what is the typical size of a group at Charlie Health? And is there a minimum number that must be met?
Yes. So the minimum number is 2. We have to have at least one other friend to be with you. I would say typical size on our older adults group is around 6 to 8. It never would go over 8. In my experience and exposure of sitting in on them, I usually see 4 to 6. So I message 4 to 6. So somewhere between 2 to 8.
Fantastic. All right. Well, thank you all so very much for being here today, for joining Mantra and Charlie Health. Thank you so much to Erin and Savannah for everything that you provided. I feel like I learn even more about Charlie Health each time that we get to be in a space together. Thank you for everything that you're doing. And again, please take the post-event survey after you leave here today. Please follow up with either of us, any of us. If you have any questions, we're all in this together in supporting student mental health and well-being. So thank you all very much. Have a great rest of your Wednesday.